One of the things that we are also trying to achieve is we believe in this country that we ought to have a social safety net. We believe that we ought to have a safety net to catch people from slipping through the cracks, to help people when they're down on their luck, and to help people who cannot help themselves. Problem is, our social safety net is fraying at the seams. To how we repair our social safety net, I want to turn to Todd Young from Indiana.
Well, we mustn't just focus on getting government smaller and more efficient. It has to be more effective. And nowhere is that more apparent than with respect to our nation's social safety net. We in this budget build upon the successes of welfare reform in the 1990s, starting with Medicaid, which we know is a program that for decades has ensured access to health care to millions of low-income Americans. We want this program to be sustainable. Unfortunately, under the current financing model, it's unsustainable. So we took a look at the financing structure, which is driving our national debt higher and straining state budgets. Governors like Mitch Daniels of Indiana, governors of both parties from around the country are asking for more flexibility with respect to the Medicaid program. We give it to them. Our approach is to end the onerous one-size-fits-all approach to Medicaid financing. Instead, we convert all federal spending into block grants, into allotments to each of the respective states. We give governors, in conjunction with their state legislatures, the flexibility to tailor Medicaid to the needs and desires of their own citizens. We took a similar approach to food stamps and to housing assistance. These are other one-size-fits-all Washington programs where we change them to block grant programs to the states. We give, again, governors flexibility to target aid to the neediest citizens. And finally, we recognize that the best welfare program is ultimately a job. So we reformed our job training programs. We consolidated the current complex maze of dozens of federal job training programs into a single program, a program that we can hold accountable. It's a targeted scholarship program that is going to truly prepare our workers for a 21st century globally competitive economy. These are bold programs, bold reforms, but they're reasonable reforms, the sort of thing that many of us campaigned on before we came here in Washington. I welcome a constructive dialogue with our colleagues about how we can further strengthen and sustain our social safety net for our lowest income Americans. Thank you so much. And next will be Dr. Price to discuss the reform of health entitlements.